Hey everybody, welcome back. And today we are seven weeks post-op, 42 days post-op today. Today was a very, very important day. As you can see, I get tired of the audio from the GoPro being such a distance away. So we're going to use my studio mic here. A lot has happened in the last week. We reached the first time where I would go to sleep one day and I woke up and a lot of things were different with my shoulder. Earlier, I believe in the last video, we talked about potentially going on a slow snail's pace and then hitting a plateau and then going at another snail's pace. That's pretty much what happened. I had therapy yesterday. I woke up yesterday and it was the best day that I have had since before my surgery. I wasn't in any pain whatsoever. Right now, I don't have any pain. Like, I can do this, man, I have no pain. None whatsoever. It gets uncomfortable and it starts hurting when I start pushing it past the normal range of motions where I'm supposed to be. As of right now, we are in phase 2, which we are at 4 weeks of physical therapy. So we are just out of phase 1 and into phase 2 for a couple of weeks. We kind of jumped ahead a little bit to try to hotshot some of it. I have a doctor's appointment tomorrow. This is with my primary doctor. They're going to prescribe me steroids to help with some of the inflammation here. This is something that they did not want to do prior. They wanted to make sure that everything healed properly and the inflammation. That's why they don't want to give you anything for inflammation aside from like ibuprofen or Motrin or something like that. But they're going to prescribe me some prednisone tomorrow. That is to help with some of the inflammation in this area here. This is what my shoulder looks like. It looks really, really, let me move the microphone out of your way. Looks really, really good. Can't really tell unless you look right up there that you can see the incision sites are healing very, very well. So I'm really, really excited about that. Let's talk about mobility. Let's move this. We can do this about right here before our shoulder stops us and does not feel pleasant whatsoever. And this arm, it's about going right here. From sitting down, this is a little bit higher than 90 degrees. The hardest thing about all of this isn't the pain. The hardest thing is everything from here and all of this. This is where it hurts the most, is where they did the most work on that AC joint, that labrum, and that biceps tendon is all right there. So this here is really, really stiff and it's really, really tight. So if you can see when I lift my arm up out to the side, my entire shoulder moves because all of everything is so tight. Where I do it on this side and I'm going up, it just moves on its own. You don't see my entire body going like this. It's because all of this is so stiff, and this is the number one thing. This is the biggest thing over the next couple of weeks that we're focusing on, is because once we get this stiffness gone, our mobility and range of motion is going to come second nature. But the biggest thing to do is to retrain my muscles when to fire and how they should fire. And so physical therapy, we're doing a lot of arm bands where we're coming here. We're doing this. We're pushing with the arm band as far as we can to help on the subscapular muscles with the external rotator in the back. We're doing bench presses with no weight. It's like a 2-pound weight. The bench press is not so bad. We're taking the bar and raising it as far back as we can, which I believe right now would be to about, if I'm laying down, it's to about right here. We have a pulley system that will allow my shoulder to go up and down, which is what I use to stretch it out when it starts getting stiff. I usually do that about 2 or 3 times per day. But progressively, based on the treatment plan, everything looks to be situated for me to return back to work probably the first week of February. I know February is still quite a ways away, but we're only 4 weeks into therapy. So out of 4 weeks into therapy, we're only a third of the way done. So we've still got another 12 weeks of therapy to go. So we still got a long way to go, a lot of therapy to go. This week we have therapy twice a week. We had it yesterday. We have it again tomorrow. And then next week we start doing it. We go back to 3 times a week. We're kind of rotating them 3 times a week, twice a week, 3 times a week. And we're doing that for a very specific reason. I could have scheduled it for 3 times a week every week, but I want to schedule it for it so that way it's similar to some of the days that I work. If you notice, in 1 week I would have 3 days off. On the next week I would have 2 days off. Insurance will reset at the first of the year, and once that happens, we will, for the last little bit of January, it is literally towards like middle of December until it's time to go back to work. It is 100% strengthening. We go from less than 5 pounds to 10 pounds. Once we move up to the 10 pounds, then we're able to go to the gym. We're still not able to go to the gym yet unless we're doing cardio. They don't want me to doing it because they don't want me to stress the rotator cuff and the other muscles around the area because they know how I am. They know I don't stop, and they know I will push myself through any type of pain whatsoever. So that being said, they are not going to allow me to go to any type of gym to do any type of physical lifting or physical activity. They don't want me to be lifting anything heavier than a glass of water. Granted, we're still 7 weeks out. We've still got a long way to go. Not assuming that this thing will probably be ready to, start building tires until easily probably February. Even once we get the range of motion back, it's all about being able to withstand and hold the weight. And I think the plan is until it's strengthened to be able to contain 50 pounds over my head sustainably without any pain. It's not going to be go time. So that won't start happening until we start doing strengthening. Granted, when we go to physical therapy, it's not fun. Okay, it's not fun by no means. I'm still taking pain medicine before physical therapy. The doctor is not going to prescribe me anymore, but the pain medicine that I have is being used strictly before physical therapy. Now that we're getting into the rotation where we're moving things out, where we're going from where initially we were here, now we're here, and we're coming all the way out here. And as you can see, the external rotation out is perfect. I have 0 pain whatsoever on external rotation, which is really, really good because it seemed to be one of the things that the surgeon was the most concerned about after the surgery. But being the fact that my external rotations is at a full 90 degrees right out of the gate, it's a good sign. So all we've got to do is just work on this here. And then, of course, we got that in the back. But that in the back is going to come probably, we'll start working on that next week. So everything is going well. It's going so well that we've planned a trip in December. So we're really excited about that. It gives us a chance to get out of the house and get away from streaming every day. So, I mean, it's been fun, streaming every day has been fun, and we've trying to space all of our content that we got from Disney, and we're trying to space it out. We still have a buttload of vlogs that we haven't done, so we're trying to space things out so that way it lasts until we go back to a park. We definitely have enough to contain us until December easily, but I want to be able to contain us for a whole another calendar year after that, so that way when we go back to Disney with a friend of mine, we'll be able to do some really, really cool stuff. That's it, man. That's 7 weeks, 42 days post-op. Started doing external rotation. We've been doing external rotation for 3 days. the most annoying part of my pain comes during and after exercising. And like I said, it's this area here, which is so stiff. But the one part that's not stiff is the biceps tendon leading into my bicep. This area here gets pissed off, and it causes the most, my idea of pain, it's not the same as what most people's would be. It's not really painful. It's more annoying than painful. So just something to think about if you're going through this. You're probably going to have some moderate pain during this time. That's because these muscles have been dormant and they have atrophied, and they've been sitting for about 4 to 6 weeks. So they're not used to being moved. They're not used to doing all of these things. So just something to keep in mind. There's a reason why we are still taking pain medicine before therapy. And once we go through, if we go through a bad patch where we're having a lot of pain, we'll still take pain medicine. That's what it's there for. So that is week 7. Really looking forward to next week. Next week will be 2 months, 2 months post-op. So really excited about that. So that's going to do it for this one, man. Thank you guys so much for watching. And if you want to see more videos like that, hit the subscribe button, turn on notifications, and we'll see you guys in the next one. Peace.